What's going on, YouTube? It's Big Brother 749 coming back at you with another video. Alright, I just want to give a public service announcement, just giving a heads up, a reminder, something to be aware of. And first off, before I even get started with this video, let me just put this disclaimer out there. And let me just say that this ain't even an anti-vax video. This pandemic is real. COVID-19 is real. And it needs to be taken seriously. And I ain't downplaying the seriousness of this virus. But while we're doing all we can to protect ourselves, staying masked up, getting vaccinated, we also still got to be aware of these other diseases too that rarely gets talked about nowadays. Because ever since this pandemic came about in February of 2020, it's been addressed a lot, and because of the publicized exposure and the media attention of the COVID-19 pandemic, I felt that might have distracted us and made us feel that these other viruses are not as relevant and might have been put in the back burner when they still actually count just as much as COVID. Because with all these COVID cases, like how often do we hear about HIV nowadays, or cancer, or diabetes? Because I could say that one positive thing about this whole pandemic is that it sort of forces and demands the world to start taking care of themselves, preventing them from contracting COVID-19. And unlike the other viruses, this is a virus that has a vaccine that can easily fight it, keep it from getting worse. But because, you still got a lot of folks out here who are finally taking precaution, staying masked up, doing whatever they can to prevent themselves from contracting this virus, but they wasn't practicing those same safety procedures when it came to having unprotected sex with multiple partners. And they wasn't even concerned with contracting an STD. And I feel that many illnesses have been overshadowed. And yeah, COVID-19 should be addressed and people need to be aware of it, but it shouldn't get to the point to where even doctors and hospitals are ignoring the other diseases and illnesses, to where people with non-related COVID illnesses are being put to the side or overlooked, to where you got much needed surgeries that's being canceled or postponed because there's a lot of these anti-vaxxers out here getting sick from contracting the COVID-19 virus, all because, they still don't want to get vaccinated, taking up too much needed hospital space. And it also shouldn't get to the point to where patients who suffer from other things unrelated to COVID-19, like a mild heart attack, for example, to where, they're not receiving any assistance, if they're not there to be tested for COVID-19. I'm hoping it doesn't get to that point, because COVID-19, it seemed like it basically became the substitute for other diseases and viruses. And now we couldn't tell the difference between, COVID-19 and the flu. And it could even make folks who don't even have COVID-19 paranoid. Whenever they catch a cold or whatever, they're going to think they're experiencing symptoms of COVID. Like if someone were to be admitted to the hospital for something unrelated to COVID-19, when that happens, the first thing folks are going to think about is COVID-19, and that may be the first thing doctors would test for before actually getting to the real cause. Or if someone passes away, especially if it's an older person, the first thing folks are going to think of or wonder about is whether or not they died of COVID-19 and nothing else. Or like I said, there could be times where someone could be having allergies, a badass cold, or coughing real bad, just a simple cold or sinuses or whatever, and everyone would be freaking out, running away, trying to stay away from you, not want to be around you, and would instantly think that you have COVID. And see, the thing about that is that with this COVID thing, we just got distracted, and it's being addressed more often than the other viruses because it's still a relatively new virus that hasn't really been around that long. It's a highly contagious disease that can easily be spreaded and transmitted just by breathing. It's spreading nationwide, and it's still taking folks out. It's fatal, and it's killing more people than the Spanish flu has. And it's happening globally all over the world. It's all year round. It's not a seasonal disease. It's not as avoidable as the other viruses and diseases. It's more blatant, in our faces, and we ain't got to be doing anything wrong to catch COVID-19, because you can catch this shit just from simply breathing. And I think the rising deaths of COVID-19 distracted us, of being aware of the other diseases, because this is something new. And this is different from catching a cold, since catching COVID is more deadly and with much more suffering and much more death. And I'm sure these other diseases, illnesses, and viruses we thought we forgot about has already been addressed and, has received media attention. And while they're still relevant today, they're not really new diseases because, for example, the AIDS epidemic, for example, had already been addressed and publicized many years ago, and it's something everyone knows about by now. Because when it was first addressed in the 80s, it was a big thing, a very serious disease. It was the big thing folks were talking about back then, and like with this COVID-19 pandemic, the AIDS epidemic sort of distracted folks and almost made every little sickness that wasn't related to the epidemic a potential result or symptom of the AIDS epidemic. Like if a guy had a bad cold or got sick and lost a lot of weight, the first reaction folks had was that this person was showing symptoms of HIV and AIDS. And this was even going on with black male entertainers in the 80s. Rumors that they got AIDS or they could be gay, and while a lot of people weren't even aware of the other diseases they might have had because the AIDS epidemic distracted the world, it was still a relatively new virus at that time. And the first reaction folks would get was that they contracted AIDS. And today, with the coronavirus being the number one top headline news, it's natural that folks are going to have a reaction and think of COVID whenever something's wrong. But even if it's not related to COVID, we still got to be aware of these other diseases that's not being talked about, because just because they're no longer being addressed by the media anymore like they're doing now with COVID doesn't mean that they're no longer relevant or not as relevant. Because COVID-19 is what's currently on the news right now, but it's not the only disease that's out there. It's just being addressed more because it's the most recent current disease. But these other diseases still do exist, and we still got to be careful and do whatever we got to do to take care of our health, because you still got folks out here who may put on a face mask before stepping outside, but still don't bother to put on a Jimmy hat before having sex with multiple partners, who also got multiple sex partners, because while they're aware of COVID, as they should be, they're not aware of the potential chance of catching STD, AIDS, and HIV. And this goes for men and women who don't believe in safe sex or using any forms of protection, having sex with any and everybody. And then there's other risk factors, such as smoking cigarettes. People may take their face masks off to smoke a cigarette, and then after they're done smoking, they'll put their face masks back on, because while they're aware of COVID, as they should be, they don't think about the potential chance or the consequences, such as lung cancer, even when there's a warning label that says so on the box, the pack of cigarettes. And then there's people out there who don't eat right, who eat things such as sugary foods and drink sugary beverages. People may take their face masks off and would hog down all the donuts, cakes, pies, and cookies, shoving all that shit down their throat, and then chug it down with gallons of soda, and that's all they ever eat and drink. And then when they wipe their mouths and hands and put their face masks back on, and because again, while they're aware of COVID as they should be, they're also not aware of the possibility of diabetes. And like I said, there's other diseases and other ways you can contract it that's hazardous to our health. And there's other ways you can get diseases, illnesses, and viruses, some with no fault of your own. But we still got to be aware of these other diseases and do whatever we can to prevent the chances of us contracting any sorts of viruses or diseases. Because COVID-19 is what's hot on the news right now. It's very deadly. But it's not the only disease that's out. It's just being addressed more because it's the most recent disease that's out. But these other diseases do exist. They just got overshadowed with this pandemic thing, and we just got distracted. But they still should never be put under the radar. And like I said, while COVID-19 should be addressed, we also still got to be aware of these other diseases that don't get talked about as much. Because like I said, just because they ain't receiving as much hype or getting a lot of noise in the mainstream media right now doesn't mean that they're no longer relevant or no longer exist, because they still count just as much as COVID. But that's all I want to say, folks. This is Big Brother 749 signing out. I'm out. Peace.